Welcome to India TV. You're watching Health DNA with me, Anshu Jaising. And today on Stroke Day, we have Dr. Jyoti Bala Sharma, Director, Neurology Department, Fortis Hospital. And she is going to help us understand what is stroke and the importance of recognizing the signs and symptoms at the right time. Welcome, ma'am.
Thank you.
Ma'am, what is stroke?
This is a very good question. Brain stroke or heart attack, both are similar. If same thing happens in heart, we call it as heart attack. If it affects brain, we call it as brain stroke. Brain stroke occurs when blood supply of brain is interrupted. Right? When the moment blood supply of brain is interrupted, brain neurons, they do not get oxygen and nutrition and they begin to die. Every minute, almost millions of neurons are lost. And as we lose time, more and more neurons, they die. And our brain control all bodily functions. So the bodily function controlled by that part of brain is lost. And that is what results in brain stroke.
And what are the different types of stroke?
There are two types of stroke. One is ischemic stroke, when the blood supply is interrupted by the clot. And the other type of blood stroke is hemorrhagic stroke. Hemorrhagic stroke when the blood supply or artery, it leaks and there is hemorrhage into the blood. That is called as brain hemorrhage or hemorrhagic stroke.
Ma'am, what are the warning signs and what are the risk factors that we can also, and how should we manage these?
The warning sign of stroke, signs and symptoms of stroke. To recognize stroke, there are certain signs and symptoms. Like as I told you, the brain control all bodily functions. So right side of brain controls left side of the body and left side of brain controls right side of the body. So when brain stroke occurs, that bodily function is lost. So we can recognize those functions by facial droop, arm droop, slurring of speech and other functions of body like blurring of vision or giddiness. All these could be symptoms, signs and symptoms of stroke. And you can recognize all these signs and symptoms with a simple mnemonic B fast, wherein B stands for balance. If suddenly you have giddiness or imbalance while walking, E stands for eye symptoms. In eye symptoms, you can have blurring of vision, you can have double vision, or you can have complete loss of vision in one eye. And F stands for facial droop. If you have facial asymmetry on one side, this could be a sign of stroke. And A stands for arm droop. And S stands for speech. If you have slurring of speech, difficulty in comprehending speech or speaking, this could be a sign and symptom of stroke. And T is very important component, time. Time is very important in the treatment of stroke. If all this has happened within 4.5 hours, and this patient should be rushed to nearest hospital for emergency treatment. So another simplest way of recognizing signs and symptoms of stroke is Indian greeting Namaskar. And if you say someone Namaskar and you feel that smile is not equal on both sides, or patient is not able to reciprocate Namaskar and there is difficulty in speaking or there is difficulty in lifting arm, 80% of signs and symptoms of stroke you can pick up this way. This is the simplest way.
Ma'am, what are the risk factors? Like what could be the possible causes?
Possible risk factors can be divided into two main categories, modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors are advancing age, male gender and certain ethnicities. They are more prone to stroke. Since these are non-modifiable risk factors, we will not discuss about these. We will discuss about modifiable risk factors. 84% stroke risk factors are modifiable, and those modifiable risk factors can be further divided into person-related risk factors and those risk factors which require medical treatment. If you ask me about the modifiable risk factors which can be handled at individual levels, those are physical activity and healthy eating habits, smoking, excessive alcohol intake and weight. If all these factors are within range, you can largely control the risk of stroke. And there are other modifiable risk factors which require medical interventions like diabetes, hypertension, and if you have some heart problems like atrial fibrillation or any other heart problem, and there is another problem which is known as obstructive sleep apnea, that also requires medical interventions. So these risk factors require medical interventions, but majority of the risk factors like sedentary lifestyle, unhealthy eating habits and physical inactivity, all these are precursors of other diseases like diabetes, hypertension and OSA. So if you largely maintain a healthy lifestyle, majority of the risk factors can be controlled. 80% of the strokes are preventable if you work on these risk factors.
Ma'am, what are the treatments available?
This is very important question. As I told you that in case of stroke, millions of neurons are lost every minute. So time is very important in the treatment of stroke. If a patient of stroke receives clot busting treatment within 4.5 hours, majority of the symptoms can be reversed and patient can lead independent life. And on the other hand, if you do not receive timely treatment, there is a high risk of death and disability, and you are dependent on others for your rest of life. So time is very important in the treatment of stroke. If it is a ischemic stroke or stroke because of the clot, if you receive clot busting treatment within 4.5 hours, which is known as golden period, so that is the best treatment option for these patients.
So when talking about golden hour, why it is crucial also if we have crossed that time limit of golden hour, what are the available options, then what should we do?
You are very right. Sometimes most of the patients, they are not aware about the stroke, and sometimes they come after 4.5 hours. If they come to us after 4.5 hours, certain patients can be offered mechanical thrombectomy, but only selected patients can be offered mechanical thrombectomy. In mechanical thrombectomy, just like in case of heart attack, we do the angiography and angioplasty. Same thing is applied to brain. You directly access the clot and retrieve it mechanically. Though the offer of mechanical thrombectomy can be given to the patients up to 24 hours, but only in selected patients. As I told you that every minute we lose millions of neurons. Earlier is better. If you pick up the symptoms early and act soon, that's always better for the patients.
Ma'am, is it that we can take the patient to any hospital, or it has to be a stroke-centric facility?
This is a very good question. You can take the patient to any hospital provided they have facility of doing CT scan, and they can differentiate between hemorrhagic stroke and ischemic stroke. And second prerequisite is availability of neurologists, either in hospital or on call. If you have availability of neurologists and facility to do CT scan, this is the minimum prerequisite for any hospital to offer treatment for acute stroke. Otherwise, what happens, like patients, they land up in any hospital, and after reaching there, they realize that they do not have the facility of brain imaging. Then patient is sent to another center, and by the time patient comes back, we lose the precious time, which is known as golden period or golden time.
Ma'am, how common are stroke these days, especially among youngsters? Do you see that there are cases rising in youngsters?
Yeah, this is a very good question. The case, whenever we discussed about stroke, we always had the image of elderly person in 60s and 70s. But these days, like we are seeing very commonly, stroke is affecting young people in their 20s, 30s and 40s. And incidence of stroke has risen by 40 to 50% in youngsters. In our center only, we treat 25 to 30 people of young stroke every year. So there is a rising trend of stroke in youngsters, and this is because of rising incidence of other diseases, lifestyle changes and diabetes, hypertension, heart diseases, obesity, smoking and alcoholism. There is an increase in incidence of all these diseases, and that in turn leads on to increasing incidence of stroke in youngsters.
Ma'am, what could be the long-term consequences of stroke?
Long-term consequences of stroke, if not treated within time, person can be disabled for rest of the life, or there is a high incidence of death. Unlike heart attack, where the presentation is very dramatic, you have pain, stroke is painless and presentation is not very dramatic. That's the reason most of the patients are not aware about the golden period or period of 4.5 hours. And majority, if you talk about world over, only 1 to 2% of the people, they come within that window period of 4.5 hours. Rest of the patients, they do not come within that time period, and they do not receive timely treatment. And if they don't receive timely treatment, depending upon the size of stroke, the disability is dependent. Disability and death, both are dependent on that. And disability and death in stroke is not immediate. Maybe that's the reason people are not as aware as they are aware for heart attack. In heart attack, first of all, the presentation is very dramatic, and secondly, it's painful. Thirdly, the results are all or none. Either you die immediately or you are saved. In case of stroke, death and disability, both are very gradual and very slow. Maybe that's the reason that people are not that aware about a heart attack, about brain attack.
Ma'am, also I wanted to understand, are these signs and symptoms when a person is getting a stroke is different? Do you think that varies from person to person?
Signs and symptoms of stroke?
Yeah, if a person is getting a stroke, does that vary the signs?
The symptom varies according to the part of brain which is affected.
Okay.
Not from person to person. It will vary from the part of the brain.
Okay.
It depends which part of the brain controlling what function of the body. If that particular part is affected, for example, like sometime temporal lobe of the brain is affected, which will make the person confused. Patient will be walking around and talking but confused, and you'll not get to know that this is stroke. Because the common perception is stroke occurs only if you're not able to move one side of your body.
Correct.
So symptoms and signs vary according to the part of the brain which is affected. There is a part which affects your vision, which is occipital lobe. If that is affected, you will be walking and talking, but your vision will be affected. So you will not realize that this is a symptom of stroke unless you are aware.
Ma'am, how can we prevent ourselves from stroke?
This is a very good question. According to me, if you address three key areas: stress, physical activity and healthy eating habits, you can put away rest of the diseases like diabetes, heart disease, obstructive sleep apnea, obesity. So you have to just work on stress management, you have to work on physical activity and healthy eating habits, and you have to avoid smoking, you have to avoid alcoholism, especially the excessive alcohol intake. By doing, like, you don't need very rigorous precautions. By doing this much, you can save from deadly disease which is known as stroke or brain attack.
Ma'am, what would be your message on World Stroke Day?
My message is stroke is a treatable condition. First of all, it's an avoidable condition. 80% of the stroke can be avoided if you maintain healthy lifestyle, if you avoid smoking and excessive alcohol intake and de-stress yourself, and if you have any disease like diabetes and hypertension, you can keep it under control with proper medication. And secondly, God forbid if despite all this stroke happens, then you have to recognize the symptoms of stroke early, because if you recognize the symptoms of stroke early, in most of the cases it can be treated and you can lead functionally independent life even after stroke. Stroke cannot put full stop to your life.
Thank you so much, ma'am, for giving your time. It was really a pleasure talking to you.
Most
Thank you so
welcome.
much.